This drawing summarizes the pattern of disease that we recognize with the condition rheumatoid arthritis. And I'm going to talk through it now. So I'm going to remove the labels and just look at the image and try and absorb the information that the image attempts to portray. Rheumatoid arthritis is a form of arthritis which is associated with inflammation and proliferation of synovium. It affects about 1 to 2% of the population, and it's about 3 times more common in women than it is in men. The causes of rheumatoid arthritis are not fully understood, although it is thought to be due to an autoimmune reaction and is associated with elevated IgG and IgM antibodies. The ESR blood test, the erythrocyte sedimentation rate, can be used to reflect the severity of the disease. Now, the condition often affects small joints of the hands and of the feet, but curiously the distal interphalangeal joints of the fingers, for example, tend to be spared. It can, however, affect the hips and the knees and the elbows, and all of these are, of course, synovial joints. 90% have some degree of hand involvement, and I'm just going to talk through that now. In 10%, the hand involvement can be really quite severe. So patients can develop a boutonniere deformity, which is illustrated here, affecting the index finger. They can develop a swan neck deformity, which is illustrated here, affecting the middle finger. They can have problems with joint subluxation, which typically tends to occur in an ulnar direction at the MP joints, the MCP joints here. They can have problems with soft tissue destruction and tendon rupture. They can also get problems with carpal tunnel syndrome at the wrist. And the thumbs can be affected, and here we see a typical Z thumb deformity. They can also get splinter hemorrhages affecting the nails. Rheumatoid arthritis typically leads to early morning stiffness, and a whole range of other problems within the body can occur. Patients can get a dry mouth and dry eyes due to involvement of the lacrimal and the salivary ducts. And when this happens in combination with rheumatoid arthritis, it has a name. The condition is called Sjögren's disease. Patients can also have problems with the bones of the spine, and they can have problems with instability or subluxation at the atlantoaxial joint in the neck. Now that can be important if patients are having surgery from the point of view of intubation. They can get lymphadenopathy, which can be generalized. It's said to happen in about 10% of patients. In terms of the lungs, they can get pulmonary fibrosis or honeycomb lung as it's called. And they can also have problems with pleural effusions, which tends to be exudative. The pericardium of the heart can be affected. Pericarditis can occur. They can get splenomegaly. Renal involvement, in particular in relation to renal amyloidosis. They can get nodules forming, which tend to occur at pressure points, typically over the elbows, for example. Other joints can be affected all around the body, the hips, the knees, and so on. They can get cyst formation, and when cysts like this occur behind the knee, they're called Baker's cysts. Ulcers can occur on the legs, and they can have problems with anemia, low blood levels in terms of red blood cells, which incidentally is normally a normochromic, normocytic anemia. The blood cells are of the normal size. Patients can have problems with peripheral neuropathy, which is often a glove and stocking, inverted commas, distribution affecting the distal parts of the limbs, the legs, and also the hands as well, in actual fact. Last thing just to mention is that sometimes the lungs can be affected, and pulmonary nodules can develop, and a condition called coal miner's lung can develop. And this, when it occurs in combination with rheumatoid arthritis, also has a name. It's called Kaplan's syndrome. So there we have the pattern of disease that we recognize as rheumatoid arthritis. Now, rheumatoid arthritis can be actually quite difficult to diagnose, and this is sort of illustrated, I suppose, as it were, by the fact that there is no single test that we can use to diagnose the condition, and we can only recognize the pattern of the disease and diagnose it sort of clinically. Now, the American College of Rheumatology lists the following criteria, and when 4 or more of these 7 criteria are present, rheumatoid arthritis can be diagnosed. Now, the first 4 factors must have been present for at least 6 weeks to be able to do that, to be able to make that diagnosis. So again, let's just remove the labels and just focus on the image to help us be able to recall these different criteria. And there are 7. So we'll start at the top. We've mentioned already morning stiffness affecting the joints, which should be for at least an hour to tick that criteria. Involvement of at least one swollen area in the wrist, in the hand, or in the finger joints. So there has to be some involvement of the wrist, hand, or finger joints to tick one criteria. Symmetric arthritis involving the same joint on both sides of the body. Illustrated there, that's a criteria. Rheumatoid nodules, which we've touched on already, that's a diagnostic criteria. These firm lumps in the skin, which usually occur at pressure points, typically the elbow. Abnormal amounts of rheumatoid factor in the blood, that's a criteria as well. 2 more to go. Swelling or fluid around 3 or more joints at the same time, simultaneously. And then the X-ray, the 7th criteria to consider. X-ray changes in the hand and the wrist, which are typical of rheumatoid arthritis, will generally represent areas of destruction of the bone around the joint. But bear in mind that these changes that occur on X-ray often happen at a more late stage. So to identify the condition early, it's likely to be these other criteria that will help. So I hope you find that helpful. Again, as with all these drawings, the idea is to give you a mental, or to give you a visual image which you can hold in your mind's eye to help with recalling information.